Welcome back to our Integrative Women's Health course. Today's topic, we will be looking into 奔落, abnormal uterine bleeding. Abnormal uterine bleeding. The definition of it is frequently also termed as dysfunctional uterine bleeding, and is defined as an abnormal uterine bleeding in the absence of any kind of organic disease. Dysfunctional uterine bleeding is the most common cause of all abnormal vaginal bleeding during a woman's reproductive years. And today I'm going to share with you a very, shall we say, a very common case from Dr. Ding Qi-ho. It's a 45-year-old woman, married, and having abnormal uterine bleeding for 3 months. She has irregular menstrual cycle since 1 year ago, fluctuating up to 10 days. Menstrual flow is moderate and not heavy. 7 days to clean, and began 3 months ago since menstruation. Bleeding has not stopped since then. She exhibits also fatigue, restlessness, insomnia. Her appetite is okay. There's no abdominal pain. There is no fever. The bleeding is moderate. It's kind of palish red and thin viscous. And the tongue is flabby. The coating is thin and yellow. And the pulse is deep, slow, forceless. And her pelvic exam has been pretty normal. There's nothing abnormal in her pelvic exam. Now, the abnormal uterine bleeding and if we look at abnormal uterine bleeding, it has a wider terminology in Western medicine compared to in Chinese medicine. It can denote to bleeding between periods. It can denote to bleeding after sex, spotting any time in the menstrual cycle, bleeding heavier or for more days than normal, bleeding after menopause. So it's a big category in Western medicine, while Chinese medicine break it down in different ways. In Western medicine, it tends to be not broken down. It's basically this big topic called abnormal uterine bleeding. And there are many different variety of causes. The very first, obviously, pregnancy. Sometimes pregnancy, you can create abnormal bleeding. And especially ectopic pregnancies when the bleeding and the cramp can be strong. Adenomyosis, where you have uterine endometriosis growing in the uterus, within the myometrium, within the lining of the uterus. Adenomyosis can cause irregular bleeding of the uterus. Intrauterine devices, intrauterine system that you use, or even oral contraceptive pills. Maybe uterine or cervical infections. Fibroids, certain fibroids, when it's growing into some of the blood vessels, in the endometrium, into the cavity, it can promote and induce bleeding more. If you have problem with blood clottings, such as a situation with clotting factor issues, polyps issues, endometrial hyperplasia issues, even cancer of the cervix, uterus, or vagina, all three regions can cause abnormal bleeding. And not the least, sometimes in polycystic ovarian syndromes, we can also see this kind of problem of abnormal uterine bleeding. So the exams are usually several areas systemically you want to go through. First, take a good history. Take a look at a history. History can tell you a lot. And the next thing is having a sonal histogram. Might be a good idea to visualize the uterus and see if there's any abnormality in the uterine cavity. Ultrasound are also very good to take a look at the ovary as well. MRI, when all those two fails, you can do a more extensive MRI. Hysteroscopy, you can send a camera up to the uterus. Endometrial biopsy to take a look at the lining, endometrial lining, and take a look at the functionality of the uterine lining. Now, in Chinese medicine, we denote AUB as Ben Luo, and Ben usually denotes to uncontrolled heavy bleeding. Luo usually denotes to increased incessant spotting or lighter bleeding. Both terms, when it comes together, this is to define an abnormal uterine bleeding outside of your regular menstrual time. And as early as in Zhu Bin Yuan Hou Lun, this wonderful pathology, etiology text, it already described this condition, and it defined both what Ben is and what Luo is. One is a sudden, quick, heavy hemorrhage, and the other one is more slow, incessant spotting. And in Jingui Yao Lue, it also discussed how to treat it by using either Wenjin Tang or Jiao Ai Tang. And there are 4 main TCM etiologies. And we start with spleen deficiency. And then deficiency, spleen deficiency, and you have kidney deficiency. Those are 2 deficiency etiology that we see. Then you have 2 main etiology of excess that creates this problem. As you know, heat drives the blood out, so it's got to be some kind of heat situation. So we have heat in the blood. So that is one of the excess condition that we see. And the other one is blood stagnation. Blood stagnation can also create such a situation. So let's take a look at spleen deficiency to start with. This can occur in people who is chronically spleen weak, constitutionally or chronic. Maybe have to do with excessive straining and or worrying. Too much worrying, too much thinking, too much concerns can also weaken the spleen. And not at least irregular, improper nutrition and food intake. This, what happens is cause deficient nourishment to the spleen. All 3 of these can cause spleen deficiency. And when you have spleen deficiency, you are going to lose the control of controlling the blood. So cause the blood to flow extravasively, and this in turn can, because spleen qi have to support the Cong and Ren channel as well, in a sense of controlling the menstrual bleeding. So when this becomes dysfunction, we are going to have Cong and Ren dysfunction. Now let's go to kidney deficiency. Kidney deficiency is more complex. It can be caused by a variety of reasons. First, you could just have a chronic constitutional kidney qi deficiency where the tiankui is deficient, where the ovulatory function is deficient. This become a dysfunction in ovulation. When you have a dysfunction in ovulation, you're going to have abnormal uterine bleeding. And the second is you could have, in a situation of excessive pregnancy, excessive labor, even excessive sexual activities, this can cause or chronic or major illnesses can all cause the damage to the kidney. Or that you have a chronic yang deficient situation in the kidney where the Mingmen fire is weakened. Or that you can have a chronic yin deficiency where the tiankui is depleted. All four of these causes a condition of true yin damage. The true essence, the true yin of the kidney is weakened and damaged. When that's damaged, we are going to create, because the essence, which is the water, grounds the fire. So now the fire is rampant. There is no control of the fire, so you're going to start to see deficient fire formation. And this deficient fire, guess what? It moves upward, it moves downward, it moves everywhere. It becomes a blood mover. And when the deficient fire moves the blood, you are going to have uncontrolled bleeding or spotting, commonly known in Chinese medicine as blood extravasation. So let's go into He in the blood. He now is an excess condition, and this could be from somebody who is constitutionally young, abundant, and or in deficiency, creating a lot of He. Or you can have somebody who is just having an emotional injury, causing liver stasis, where the liver stasis is transforming to heat. Or that you could have a situation of accumulation of damp heat. All three of these all contribute to heat damage. And this heat damage directly attacks the Zhonghen. When there's a heat damage of Zhonghen, this heat continues to move blood in the Zhonghen, cause and forces the blood to flow uncontrollably. And this, we have blood extravasation situation. The next etiology is blood stagnation. A lot of stuff can cause blood to be stagnant. Okay, so for example, cold pathogen. For example, of heat pathogen. For example, of a deficient state. For example, of stasis. All four of these can cause stagnancy of the blood. Or that you could have menstrual and gestational accumulation, where the menstrual blood is not clear, not clean. There's still some stuff left over. Or that you had a miscarriage, you have a pregnancy, where the product of conception never really completely cleared out. That can cause blood stagnancy. And that can create a lot of problems, create a lot of dysfunctions. Or you could have emotional injury, major loss. It's a trauma. When there's major trauma, you're going to cause all the energies in the body to get stuck. Nothing moves. And this is where you're going to get chi stasis and further along cause blood stagnation. So this stagnancy, if it's chronic enough, it'll start to cause blockage of the Zhonghen channel. And this blockage is where the blood does not return to the channels. When the blood doesn't return, it basically retains outside the channel, so it moves outside. You start to bleed, it doesn't want to return. So you have this stop and go bleeding. So blood stagnation caused bleeding is more volatile. Sometimes out of control, sometimes spotty. Sometimes out of control, sometimes spotty. So it's volatile. And that is the key moment of blood stagnation etiology. Let's take a look at TCM pathology. Again, the disorder location is in the Zhonghen channel and your uterus. And the pathology is the dysfunction of Zhonghen, causing the menstrual blood to be irregular and the uterus to lose its storing function. And when we have spleen deficiency, we lost control. When you have kidney deficiency, we lost storing. When you have heat in the blood, damage the Zhonghen. When we have blood stagnation, we blocks. So you have the loss of control, you have the loss of storage, you have caused the damage to the Zhonghen, and you have the stagnation cause blocking to the flow of the blood. In all this, basically, the menstrual blood lost its timing. Okay, the timing, the cyclicity is now lost. And with that cyclicity is lost, well, the uterus also lost its ability to store, discharge, build, replenish, discharge. It loses that function. Therefore, you start to have sudden, incessant bleeding, dysfunctional, spotting kind of situation. And this is Benduo. So, again, this in TCM pathology, we believe the uterus has a very strong storing function. It stores the essence, it stores the blood. Zhonghen allows it to discharge any excessive blood on a regular cyclicity of monthly. Whenever you have deficiency, whenever you have stagnancy, and whenever you have heat, all three can cause out of control. All three can cause the uterus to lose its proper storing function. So in diagnosis, our main symptoms is irregular menstrual cycle. Menstruation can last more than 14 days or several months. If you have your period flow for such a long time, it's going to be exhausting. It's going to be tired. So frequently, you're going to have combination conditions such as anemia. And it can also be accompanied with sudden stoppage or sudden hemorrhage flow. So it's volatile in the bleeding situation. And you could have secondary symptoms. You could have different levels of anemia due to chronic bleeding. And if you're not careful, you're going to get into a critical state where the patient will start to go into syncope, fainting, and a situation that can be life-threatening. So sometimes in the most severe AUBs, you literally have to hospitalize the patient, and transfusion is absolutely necessary in those situations. So there are several things we do to examine. One is ultrasound analysis, hysteroscopy, diagnostic DNC, CAT scan or MRI can also be all used. So in diagnosis, we have basically 4 major syndromes: HE syndrome, deficiency syndrome, blood stagnation syndrome, and cold syndromes. In a HE syndrome, usually we have sudden bleeding, excessive, acute, incessant with no stoppage, bright red or deep red, and it's pretty much a thick, viscous flow. When we have deficiency syndrome, usually we have a sudden bleeding or incessant flow with no stoppage. But usually this flow is much more pale, is much thinner because of a deficiency. When you have blood stagnation, then things are kind of sluggish on and off, fluctuating between heavy and none at all, start and stop. Color is purple, dark, and abdominal pain is it's like if you're in a car, you're like whiplashing. So that's a blood stagnation situation. And then you have a cold syndrome, where sudden bleeding with no stopping, pale dark flow, thin flow, and obviously with aversion to cold. And the treatment principle is very clear. When acute, treat the manifestation. When non-acute, treat the cause. So the number one thing you want to do is when it's acute, stop the flow. Okay? Cydial, that's the concept of cydial. Cydial means it's like using a stopper to cork up, to stop the flow from coming out. Okay? Stop bleeding, especially during acute phase, where the bleeding is heavy, incessant, out of control, hemorrhage, to avoid any collapse situation. That's critical. And the second principle, once you are able to do the first principle of stop the flow, the second principle is what we call distillation to find the source. Okay, once the emergency is a little bit better, the next thing is, let's find out what's going on here. What's the cause? We must seek clarification to find out where the source of the problem is. It is a non-ovulation, it is fibroid in the uterus, it is polyps, it is the cervix infection. What is it? This is a treatment principle that we commonly use during less acute stage where the bleeding is not as heavy. The third is the last treatment principle, is what we call return. Return to normalcy, and we call it 复归. 复归. After successful treatment, this is where we prevent further occurrence of abnormal uterine bleeding. The treatment principle during this period should be to tonify kidney, assist spleen, or pacify liver. Because these 3 organs, there's so much without menstruation. One is the essence, one is the flow, and the other one is the nourishment of after heaven. So all 3 has to work well. And when they are strong, when these 3 zang organs are strong, then frequently the Cong and Ren becomes strong. When Cong and Ren becomes strong, their storing, their functions becomes normal. Therefore, the bleeding stops. Abnormal uterine bleeding don't continue. So we got several syndromes here we're dealing with. We got spleen deficiency and kidney deficiency. And within kidney deficiency, we got kidney qi, kidney yang, and kidney yin deficiency. We also got He in the blood, where we have excessive He and deficient He. And we also have blood stagnation. Okay? And sometimes we can also have cold in the blood. Cold in the blood also as well. But that's a little bit less common, so we're going to drop that during our talk today. Spleen deficiency. Let's talk about that. This, we have sudden bleeding or incessant bleeding. And this is where we want to tonify qi, control blood, strengthen the tong, and stop ben. And so we will use a formula called 固本子奔汤. 固本子奔汤. This formula is composed of just a few herbs. 熟地, 白术, 党参, 当归, 黄芪, and black ginger. Okay, 6 herbs. This originally come out of 护亲族女科. And if you have fatigue, we can add 田七, we can add 益母草, or we can add 施效散, especially if you have pain, for example. Now, in kidney qi deficiency, this is where we can see irregular menstrual cycle, profuse incessant flow, just like in spleen deficiency. Here we want to tonify kidney qi, strengthen tong, and stop bleeding. So we want to use a modified 从人兔狮子王, and where we can add some 党参 into the mix, add some 黄芪 into the mix, and add some 阿胶 into the mix. Okay, 从人兔狮子丸 is a combination of 熟地、肉苁蓉、覆盆子、当归、枸杞子、三寄生、兔狮子、艾叶 and 田七. If we have palpitation, we can also add the formula of patent 桂皮丸 into the mix as well. Now, if we have kidney yang deficiency, here is we're going to have irregular menstruation, heavy bleeding, or incessant spotting, or light flow, or stop for a few months and then suddenly heavy flow again. Here is we want to warm up the kidney, benefit the qi, strengthen the tong, and stop the bleeding. Here we will use a combination of 右归丸, adding 党参, 黄芪, and 田七 into the mix. So you might have 右归丸, as you know, it's 治护子, 肉桂, 熟地, 山药, 山茱萸, 枸杞子, 兔狮子, and 艾叶. So in back pain and diarrhea, we can add 白芷, we can add 补骨汁, we can add 泡姜, extra 泡姜 or 仙柠皮 into the mix. And in kidney insufficiency, we frequently see irregular menstruation, bleeding incessantly, but not overly heavy though, and can stop for a few months and come back suddenly, just like the kidney yang deficiency situation. Here we want to nourish kidney, nourish, benefit the yin, strengthen the tong, and stop bleeding. So we want to use a formula of 左归丸 plus 二字丸. Or we can have 滋阴固气丸. Now, 左归丸, it's a combination of 熟地、山药、山茱萸、枸杞子、兔狮子、鹿角胶、龟板 and 牛膝. Very famous formula is used widely for kidney insufficiency. And then 滋阴固气汤 is a combination of 党参, 黄芪、白术、阿胶、续断、兔狮子、何首乌、山茱萸、鹿角酸、白芍 and 炙甘草. All these herbs, as you can see, starting from 党参 and 黄芪, is no longer just dealing with kidney deficiency. It strengthens the qi. We know a lot of time when you strengthen the qi, you can also nourish the yin. So kidney, a lot of time when we treat this kind of situation of kidney yin deficiency, if we strengthen the qi, we can strengthen the yin. So this formula comes out of the practical TCM gynecology. It's more of a modern research formula. It works quite well. It's a very specialized formula, especially used for Ben Nuo due to kidney yin deficiency with a little bit of kidney qi deficiency tagged onto it. Now, we can also look at He in the blood. Let's move on to He in the blood. And you might have a situation of He in the blood due to deficient He. Okay, you got two of them, deficient He and excess He. And let's talk about deficient He first. When you have a deficient He, you have abnormal uterine bleeding, incessant bleeding, or spotting, or sudden heavy bleeding. Same thing as all the other ones. You want to nourish in, clear He, strengthen tong, and stop bleeding. So there's a wonderful formula called 上下相之汤. 上下相之汤. Come out of a wonderful clinical experience book called 十四秘录. 十四秘录 chapter 6. This is a book that's written in 1687 AD. This formula is a combination of 熟地山茱萸熟地山茱萸尾蕤人参原参沙参当归麦冬五味子牛膝眼车前子is basically originally designed to treat oral mouth cavity dryness, not being able to drink and eat, poor appetite after a hemorrhage situation. Okay, so basically he says 上下相之汤 means to nourish the up and nourish the down. The nourish the down is to replenish and strengthen and control the uterus. Nourish the up is to take care of the mouth dryness and you could not eat kind of situation. Let's move on to heat in the blood due to excess heat. This is where we're going to see abnormal uterine bleeding. We're going to see sudden onset or incessant spotting for many years. And this is where we want to clear heat, cools blood, strengthen Cong, and stop bleeding. And the formula we will use is 清热固精汤. 清热固精汤. 清热固精汤 is basically a combination of 龟板 turtle shell, 牡蛎 oyster shell, 青阿胶 and 生地 地骨皮 山鸡 黄芩 地榆 and also 钟乳烫 and 生藕节 and 生甘草. Wonderful formula for treatment of heat in the blood of excess type. Now let's move on to blood stagnation. Well, blood stagnation is unique. Again, it's abnormal uterine bleeding. And you're going to have what we call sluggish, fluctuating flow, alternating between heavy to light, and sometimes can be very volatile. Sometimes you just stop bleeding. Sometimes it comes back. Sometimes you have incessant spotting, and sometimes it stops. So you want to activate blood, dissolve stagnation in this situation. You want to strengthen Cong and stop bleeding. So you want to use Dr. Fu Qingzu's gynecology's famous formula of 足鱼止血汤. 足鱼止血汤. Again, a combination of 生地. He actually stressed that you actually have to take 生地 and you have to saute it with rice wine. Saute it with rice wine. It strengthens the effect of it. 大黄, 赤芍, 丹皮, 当归尾, 止咳. And you want to use vinegar to bake the turtle shell and taolin into the mix. So he has very specific design-specific requests for both the 生地 and also the 龟板 as well. Now, we cannot not talk about the importance of stop the flow, emergency measures. When somebody is having hemorrhage, there are some emergency measures that we do, and acupuncture treatment is very versatile in this situation. And you can basically use some of these point selections for both the emergency time and also regular time. For example, one of the points that I like to use quite a bit is Bai Hui. Bai Hui basically calms the heart blood, and it calms it down in a sense it doesn't allow the bleeding to become out of control. And then usually paired with liver 1, Da Dun. Da Dun is a wonderful point. A lot of times you can maksa. Maksa is a good way to use, and sometimes you can do an incense maksa, where it's what we call 1 Da maksa, incense maksa, direct maksa onto the point. You can also use spleen 1, and a lot of time, if I do liver 1, I don't use the spleen 1. I kind of alternate them. And again, maksa works really, really well for those points. Acupuncture works really well also for those points. And not the least, ginseng. You definitely use heavy dose of Korean ginseng, Chinese white ginseng, trying to strengthen and really take care of anemia when you have sudden bleeding. Fuzi, to protect the heart. Make sure fuzi kind of stimulate the heart so the heart can continue to pump. So you can add ginseng, you can add fuzi, and you can do 田七粉, Yunnan Baiyao basically. The Yunnan white powder is so good for trauma, so good to stop bleeding. So you definitely want to use that herbs. But in this situation, a lot of time, it's an emergency room department situation. where the patient has to be hospitalized, where you have to get transfusion, there may be DNC, IV fluid, and if there's some severe uterine stuff, such as incessant uterine fibroid bleeding, maybe that if they are not reproductive age anymore, or coming to a point where they don't mind losing their uterus, sometimes you may even have to take the uterus out. So let's come back to this case study by Dr. Ding Qi-Ho. It's a 45-year-old married woman who has been having abnormal uterine bleeding for 3 months, having irregular menstrual cycle since 1 year ago, fluctuating menstrual cycle up to 10 days. Menstrual flow is moderate and not heavy. Took 7 days to clear. Began 3 months ago since menstruation bleeding has not stopped since then. And it's been fatigue, restlessness, insomnia. Appetite is okay. No abdominal bleeding. No abdominal pain, no abdominal pain, no fever. Bleeding is moderate, pale and thin. Tongue is flabby, coating is thin and yellow. Pulse is deep, slow, and forceless. Pelvic exam is negative. So you can see this is definitely a deficiency condition. And the diagnosis is kidney qi deficiency, qi and blood deficiency, and Cong and Ren weakness. So we also have to deal with the anemia part as well. So very importantly, therefore, in this situation, we want to give a lot of qi tonics and blood tonic as well. So we have Dang Sen, San Yao, San Zhu Yu, Shou Di, Yu Zhu, Di Yu Tang, Qian Cao, Xian He Cao, Nu Zhen Zi, Han Nian Cao, Wu Zei Gu to stop the bleeding, A Jiao, Chuan Duan, Mai Dong, Bai Sao, Long Gu, Mu Li, and Jin Jie. So this is the first visit that was designed to treat this patient. On the second visit, she reported that her bleeding actually has stopped for 1 week. Due to financial difficulty, she decided to stop the herb, and she just didn't want to. She has some patent Gui Pi Tang, and so she took some of that outside of her menstruation, and during her menstruation, and she would take the first formula. She just didn't want to take the whole formula throughout the whole entire cycle. And everything seems to have normalized. So it was a very effective, very quick case. A lot of time, if you get it right on, if your formula is right, if your treatment is right, a lot of time, these dysfunctional bleeding can be stopped immediately. But this is a kind of condition you got to be very careful, because if you get to a situation where the patients are hemorrhaging, you're kind of in deep trouble. This is a situation where they have to go to the emergency room. This is not something that you can handle when you couldn't stop the bleeding. It's important to be conscientious in treating this condition, in the sense of trying to really follow those principles of stopping the flow first, distillation second, trying to return the blood, return to normalcy, and prevent this condition. Thank you very much for your attention today, and I look forward to see you next time.